If that's okay. So first of all, thank you very much for coming out, and well done for finding this room. Hacking Health is made up of some very smart people, so you found the right place to be. My name is John Gregory. I'm one of the co-leads for Hacking Health Waterloo, together with Sarah Bingham, who's at the back. Very pleased to be back at Grand River Hospital, and yeah, we have three, I think, terrific speakers for tonight. The whole basis and really the way that Hacking Health works, I think, firstly, it gives us an opportunity to learn about some of the health-related both businesses, support agencies and facilities that are within our own region. And then also we really do encourage any of the presenters to then pose in terms of how this kind of community, which we have 960 people in this Hacking Health Waterloo group, can then help. So, I mean, we have people in that across all kinds of different specialties and skill sets. So I think for any of the presenters, if you are looking for either talent acquisition or if you're looking for people with particular skill sets in data science or something, then use this sort of forum to try and link up. So without any further ado, what I'm going to do is to introduce Carla to start with. Thank you very much. Thank you to Grand River Hospital also for hosting it. Sarah, thank you for setting up. Very interested in, well, both of your background actually in terms of as a Italian Canadian, is that right?
Correct.
But you studied in the US.
I studied in Italy,
Yes.
and then I moved to Canada 17 years ago.
Okay.
For personal reasons.
Yeah.
My mom is Canadian though, even though they live in Italy.
Okay.
And I will be there in about 8 days, but who's
Okay.
counting? And then when I came to Canada, I started working in clinical trials at Princess Margaret Hospital. As my husband is a radiation therapist,
Okay.
and he was there. And then we moved to the region when they opened the new cancer center here in 2003.
Yeah.
And then I pursued my second master's. So I had a master's of arts from Italy, and I pursued my second master's. Wow. And George Washington University in Washington, D.C. was offering this Master of Health Sciences with a particular focus in clinical research administration, which is what I do here at the hospital and what I enjoy doing. So okay. I pursued that, and the rest is
But I think that international, I think actually seeing different universities and different healthcare systems and how they deal with just basic problem solving is very refreshing. So I'm sure we benefit as a result of that. So Carla, well,
thank you very much.
Thanks very much.
Thank you. Thank you everybody for coming to the hospital. The purpose of the presentation tonight is sort of to highlight one of our research initiatives that we are conducting here at the hospital. This is specific to the Cancer Center. That is part of my job, is looking after oncology clinical trials in the Cancer Center, as well as research throughout the whole hospital. And my hope through this presentation is to give you an idea of the type of research that we're doing here. In research, by the type of research that we're doing, I mean, we're conducting a lot of clinical trials. We are conducting research on behalf of pharmaceutical companies, academia partners. We partner with the University of Waterloo. They usually bring the idea and the concept of the study. This is really our own baby, and this was a concept that started here at the hospital. We found our own resources, and we wrote the study protocol. We're going to be conducting the data analysis in collaboration with the University of Waterloo. But I hope that it's going to give you an idea as to how we tackle an idea that we had to implement a telemedicine clinic for prostate cancer patients that are receiving oral chemotherapy. And so instead of just diving in and doing it right away, we decided to do it as a pilot project through research. So these are the sponsors for the study. We have received the majority of our funding through the Motorcycle Ride for Dad. For those of you who may not know what this is, it's this huge motorcycle ride that happens at the beginning of June usually. And all these bikers, they raise money for prostate cancer. And so part of the money comes to the hospital in partnership with the foundation. And we start different new initiatives for prostate cancer research and innovation. We partner with the University of Waterloo. The OTN is the Ontario Telemedicine Network, and it's the platform that allows us to do the telemedicine clinic. And then Astellas and Janssen provided some minor funding for the project. So how we came about doing this? So you may or may not know, but we are regulated in the cancer program through Cancer Care Ontario. And Cancer Care Ontario is a consultant to the Ministry of Health, and they basically set the benchmark and they give the funding for all of our operations within the cancer program. And so in 2014, Cancer Care Ontario launched this culture of person-centered care. So everything has to revolve around the person, not even the patient, but as a person. So we embraced the PCC culture, and we started looking at different initiatives to really enhance the treatment and the care for our patient as them as the center of everything that we do here. So one of the idea of person-centered care was to develop a telemedicine clinic, and we were already partnering with OTN for various different initiatives, but we were not really doing a clinic. We're doing a multi-case conference. Sometimes the physicians are doing OTN between different physicians, and we wanted to really try and do it with the patients. And really, we were looking at streamline healthcare resources and really alleviate some of the burden for cancer patients of coming to the hospital all the time. So we were kind of thinking about how can we do this. So at that time, it was about the end of 2015, there were a lot of implementation concerns about doing a telemedicine clinic. And when you're looking at the cancer program, you can't, it's a busy clinic, and we have a lot of medical oncologists, radiation oncologists, we have nurse practitioners. It's not just something that we can flip off the switch and start a clinic. So we thought, okay, how are we going to be doing this? We need to have the buy-in from the physicians and from other practitioners. We wanted to design the clinic with the patient in mind. We wanted to be evidence-based, and we wanted to foster community collaboration, and there was this tiny little issue of funding, which is, pretty much constant throughout healthcare. So how are we going to implement this clinic? That's how the idea of the OTN study came to be, and that's what we call the study colloquially here at the hospital. We call it the OTN study. It really encompasses everything that we talked about. It is part of the person-centered care model. It includes the clinician's engagement. It fosters community partnership, leverages technology. It's part of our new mandate of conduct more research and innovation here at the hospital. And it will leverage the nurse and pharmacy expertise. So that's how it was born. It's a pilot study of a nurse and pharmacist-led OTN-based clinic for the management of prostate cancer patients on oral therapy. And if you would know anything about cancer, is that over 40% of chemotherapy is now delivered orally. And prostate is one of the population that uses the majority of oral chemotherapy. So I'm gonna just go back for a second. So doing it through the study, the way that allowed us to do clinician engagement is that here at the hospital, clinicians, practitioners, oncologists, they love data, and they love clinical trials. They love to see that something has been tried and that it is successful and that somebody likes it and that the data shows that it's good. And then they're a lot more keen in implementing something. So that was a huge win-win situation for us to start the clinic from that point of view. We did not want to assign an oncologist to do the clinic. We thought that the clinic could be led by two other specialists within the cancer program, which is the nurse and the pharmacist. They really know the patients very well. The pharmacists here, they manage all the cancer therapies for cancer patients. So that was another way for us to really look at whether this was feasible to do in the long run, potentially in the future. And as I said, it's a new, innovative way to, really bring care to the patients. So we designed it with the most rigorous research aspects. We did decide that we were going to do a randomization. So we decided on 2 groups of patients. Patients have prostate cancer. They are on the oral drugs that you see there. And so they are being randomized to the 2 groups. One group will receive telemedicine care, and one group will receive standard of care. So they will still continue coming to the cancer program. We decided not to make a division between rural patients, patients living in the rural areas versus patients living here in the city. We thought we just want to be broad. We'll randomize the patients just based on their therapy, and then whatever they land, and from there we're going to gather their opinion. The primary objective of this study, it is satisfaction with overall care. So one big difference compared to some of the other telemedicine clinics is that these patients will connect from home. So they do not have to go to an OTN hub to receive their care. We have a study coordinator through the funding from Right for Dad, and the study coordinator, she will go through the whole consent discussions with the patients, and then she will be the one that will do the randomization. Actually, somebody else does the randomization, but she will be the one that will find out where the patient fits within OTN or standard of care. And then she will organize the OTN appointments for these patients. So they receive a link via their email, and then they'll connect straight from home, so from the comfort of their chair. The purpose of this is to avoid them having to come to the hospital, as I said before, having to park, staying here for many hours sometimes, spending extra money sometimes on food. And it really allows us to free some of our resources as well, so that the physicians will see other patients, and these patients are being cared for by a nurse and a pharmacist. The secondary objectives of the study, we're looking at the facility of use of the OTN platform, and we are also collecting some of the toxicities. And so we're going to be doing a descriptive analysis of the interventions made by the pharmacist and the nurse on the toxicities of some of these patients. One of the oncologists that is linked with the study is always available here in the cancer center when these patients are being seen. If there is an issue, the patients are quickly brought into the hospital. But so far we've seen over 40 OTN visits, and we only had to bring one patient in once for one appointment immediately because the patient was experiencing some significant side effects. This is where the University of Waterloo will come in. The data will be statistically analyzed at the University of Waterloo through the School of Pharmacy. So the estimated sample size is not big, so this is not a huge clinical trial. We are going to be having 80 prostate cancer patients, 40 on one arm and 40 on the other arm. The appointments are about 30 minutes long. And then there is a patient assessment, and then there is open-ended question using a modified version of a tool that is used to assess patients that are on oral therapy. This is just a few of the people that are involved in our study team. So Dr. Stacy Hubey is one of our medical oncologists, and she is the local principal investigator, along with Tom Farlam from the U of W School of Pharmacy, and then the other staff that are involved. So far we have 21 patients that have been recruited to this study. 11 patients are on the OTN arm and 10 on the standard of care. We have conducted 40 OTN visits, and we're hoping that this is going to be really our future for new telemedicine clinics. And I'm actually pleased because we are seriously looking at, in the fall, implementing an OTN clinic with one of our radiation oncologists, and right after that with one of our medical oncologists, where the patients will be able to actually see the oncologist from the comfort of their home. So these are little snippets of what the patients have said so far. I just completed a very small analysis for my VP, and the feedback is really positive. The patients are happy with the care that they're receiving through the clinic. They're happy not having to come here. It's still early. We're still collecting a lot of data, but so far we are really excited about the project, and I'm very happy to be presenting it.
Thank you very much. I think it's fascinating to hear actually that there is such a strong, almost centre of excellence in terms of clinical study design and rigour here, and then also reaching out, as you say, to the University of Waterloo School of Pharmacy. I know there are a number of questions.
Sure.
Yeah. What's the frequency of the appointments?
I would have to go back and look at the specific study protocol. How we designed it is that we designed it with Dr. Hubei. So she looked at the regular appointments that the patients would have. And so we maintain the appointments that the patients would have with the medical oncologist, but we have the OTN clinics in between. So I do believe that is every 3 months that they have the OTN clinic. And then at 6 months intervals, they will come back actually to the center to have a full visit with the medical oncologist. So it's a mix of both to ensure that the medical oncologist gets a chance to see the patients. The pharmacist and the nurse will then do orders for, there is a pre-ordering system with the oncologist for blood work that can be done in the community, and then we receive the results online. Yes?
Is this case controlled? As in, like, are the patients on the standard arm similar to the patients on the OTN arm, or are they kind of random, doesn't really matter?
In terms of frequency of visits?
In terms of age, of fluency in technology, in terms of retired versus non-retired versus...
Yeah, we haven't stratified based on age or retirement status, for example. The eligibility criteria, which is pretty much, we have 2 eligibility criteria. One is that the patient is prostate cancer patients on oral therapy, one of the 2 therapies listed, it's enzalutamide or abiraterone, which is common oral therapies for prostate cancer. And the other one is that the patient has access to the technology. So other than those 3 criteria, the patients are allowed to be on the study. Yes?
Is this going to be integrated into the future EMR that they're installing at Grand River Hospital, or is this going to be on a completely separate platform?
This is already integrated into the current EMR, and so it will be transferred to the new EMR.
Okay.
And what we've done is that we have created a system for the pharmacist and the nurse to do actually a dictation.
Okay.
So the patients are scheduled into our scheduling system under an OTN scheduling appointment class that we have, so that the nurse and the pharmacist are aware of when the patients are coming. And then when they see the patients, they're able, instead of doing the whole charting, they are able to actually do a dictation that will show up in our electronic system.
Cool. So it sounds like you have 2-way communication between the EMR and the OTN platform?
Yes, correct. So
Okay.
those are separate.
Okay.
So there's the OTN platform that is used for the scheduling of the OTN appointment. So we schedule it on the OTN because the patient must receive a specific link, and then they click on the link and it brings up the appointment specific with that provider. So it's kind of like a closed loop connection. And then we have our own special EMR dictation system within our hospital.
Okay, go on.
Yes.
One more question.
Are you guys collecting other metrics as well in terms beyond just the telemedicine, but where a patient can input their own sort of set of vitals that they take at home? Because a lot of patients have blood pressure monitors and like their own.
Very good, yes, and that's where, yes, we do have blood pressure cuffs that we give to the patients. Those came from one of the industry partners, actually. We received those through them, and we do collect that information at the time of the telemedicine clinic. So they're doing that with the pharmacist and the nurse present at the time of the clinic.
Okay.
Okay. Do you want to introduce yourself? Because you obviously know the subject quite well.
Sorry, I'm Neil Naik. I'm a family doctor in the community, and I'm actually work with the people at the end of this table as well.
Yeah. Introduce yourself too.
yeah. Okay, no, that's great. And I mean, OTN was, I think we've had a previous presentation maybe a year ago that mentioned OTN, and there are so many acronyms in healthcare that it's useful also to have a calibration again in terms of, So thank you very much for presenting.
The
Oh,
OTN
Karen.
framework, is that And a trial too, or is that already well established?
No, that is a well-established
Okay.
tool.
Yeah.
And one of the, when you start a study like this within a hospital, of course, we have a lot of rules and regulations. We did go through the proper channels for ethics application, ethics approval, agreement, for data collection and data transmission. But we already had a privacy impact assessment done with the OTN because we are using OTN currently, sometimes with our multi-case conferences. And so we didn't need to validate the tool itself. So it was an extra little step that it wasn't necessary and allowed us to quickly implement the step.
Do you have to go through research and ethics approval, both obviously for the hospital, for the facility, but do you have to do it through the University of Waterloo as well?
We had to do both.
Because if
Yes.
they're doing the statistical
So Tom
analysis.
McFarlane at the School of Pharmacy, he's the one that led the
Yeah.
University of Waterloo, and then we did the
Yeah.
ethics approval here.
Sure, okay. Thank you.
Thank
Well,
you.
thanks very much again.